Okay, guys, I have discussion A for you all. Headline is Disability Free Living Among Older Adults. Americans 20, 2008 to 2017. A major study published in Archives of Gerontology and Geriatric Plus reveals a notable rise in disability-free living among Americans aged 65 and older between 2008 and 2017. Here is a breakdown of the findings and implications. Key findings: prevalence increase. The percentage of older adults living without disabilities rose from 60.8% in 2008 to 64.9% in 2017. Impact: this improvement meant 2.7 million fewer older Americans living with disabilities than expected if 2008 rates had persisted. Disability-free definition: individuals were considered disability-free if they had no serious memory problems, hearing or vision impairments, limitations in daily activities, bathing, dressing, functional limitations, e.g., walking, climbing stairs. Okay, then the next section: gender and education trends. Women's gains. Women saw a 26% increase in odds of being disability free compared to 18% of men. Education's role: higher educational attainment was a major factor. It's linked to lower rates of smoking and other risky behaviors, less physically demanding jobs, better access to health care and health literacy. Baby boomers versus older cohorts. Modest gains for baby boomers, adults age 65 to 74. Baby boomers showed less improvement, and those aged 75 plus. Future concerns: researchers caution that the slower process among boomers could stall or reverse the trend in coming decades. Societal implications. Healthcare demand. Fewer disabilities mean reduced need for long-term care and medical services. Quality of life. More older adults are maintaining independence, which supports aging in place, and community engagements, policy opportunities. These findings highlight the importance of investing in education, preventative health, and age-related or age-friendly environments. Would you like to explore how these trends intersect with frailty-aware care models or memory-friendly housing design? I think there's a rich opportunity to connect this data to your work on aging, resilience, and autonomy. Education plays a powerful role in promoting disability-free living among older adults, as highlighted in the study from Archives of Gerontology and Geriatric Plus. Here's how education enhances disability-free living. Health behaviors, lower smoking rates. Educated individuals are more likely to avoid smoking and other risky behaviors. Better nutrition and exercise habits. They tend to adopt healthier lifestyles, which protect against chronic conditions that lead to disability. Occupational exposure. Less physically demanding work. Higher education often leads to careers with fewer physical strains and reducing wear and tear on the body over time. Safer work environments. Educated workers are more likely to be in regulated, economically designed settings. Healthcare access and literacy. Navigating the system. Education improves the ability to understand and access healthcare services. Preventative care. Individuals with higher education are more likely to engage in regular screenings and early interventions. Medication adherence. Health literacy supports proper use of medications and management of chronic conditions. Cognitive reserve. Brain health. Education builds cognitive resilience, delaying on the onset of memory problems and neurodegenerative diseases. Engagement, lifelong learning, and mental stimulation help maintain cognitive function. Societal and policy implications. Investing in education, early and lifelong education, may be one of the most effective public health strategies for aging well. targeted interventions, tailoring health literacy programs for older adults with lower educational attainment could help close the disability gap. Would you like to explore how these educational pathways could be integrated into caregiver training or smart housing environments to support aging resilience? It could be a compelling extension of your work on culturally responsive frameworks. Health literacy plays a crucial role in promoting disability free living, especially among older adults, drawing from the study in archives of gerontology and geriatrics plus. Here's a detailed look at how it functions. What is health literacy? Health literacy is the ability to understand, evaluate, and act on health information to make informed decisions about care, prevention, and wellness. How health literacy supports disability-free living. Improved self-management. Older adults with high health literacy are better at maintaining or managing chronic conditions like diabetes, hypertension, and arthritis, key contributors to disability. They're more likely to follow treatment plans, monitor symptoms, and seek timely care. Preventative health engagements. Health literate individuals are more likely to get regular screenings, e.g., vision, hearing, mobility, receive vaccinations, adopt preventative behaviors like exercise and balanced diets, medication safety, understanding prescriptions reduces the risk of adverse drug events, which can lead to functional decline or hospitalization. Navigating healthcare systems. Healthcare literacy empowers older adults to choose appropriate providers, ask informed questions, advocate for themselves in clinical settings. Cognitive and emotional resilience. Engaging with healthcare or health information stimulates cognitive function, reduces anxiety and confusion around medical issues, supporting mental well-being. Equity considerations. Low health literacy is more common among individuals with limited education, non-native English speakers, and marginalized communities. Addressing this gap is essential for reducing discrepancies in disability outcomes. Physical applications, caregiver training, embedding health literacy principles into caregiver education can improve outcomes for both caregivers and recipients. Smart housing, integrating intuitive health tech interfaces and reminders can support older adults with varying literacy levels. Frailty aware models. Health literacy assessments could be used to tailor interventions and support autonomy. Would you like to explore how health literacy could be embedded into memory friendly housing design or culturally responsive caregiving frameworks? It feels like a natural extension of your work on equality or equity and autonomy. Great question. Improving health literacy in older adults is essential for supporting disability free living and aging resilience. Based on the study from archives of gerontology and geriatrics plus and broader best practices, here are some effective strategies. Strategies to improve health literacy in older adults. Simplify communication. Use plain language and avoid medical jargon. Break information into digestible chunks. Use visual aids like diagrams, icons, and color coding. 2. Tech-backed methods. Encourage older adults to repeat information in their own words. Helps confirm understanding and reinforces learning. Culturally responsive materials. Tailored content to reflect cultural values and language preferences and health beliefs. Use relatable examples and inclusive imagery for interactive learning. Incorporate role playing, storytelling, and hands on demonstrations. Use digital tools like tablets or smart displays with guided tutorials. Caregiver involvement. Train caregivers in health literacy principles. Encourage shared decision making and collaborative care planning. Accessible technology. Design user friendly health apps and smart home interfaces. Include voice commands, large fonts, and intuitive navigation. Community based programs offer workshops, in senior centers, libraries, and adult daycare programs. Partner with trusted local organizations to build engagement. Health literacy screenings. Integrate assessments into routine care to identify needs. Tailor interventions based on literacy levels and cognitive capacity. Integration with your work. These strategies align beautifully with your focus on memory-friendly housing design and environments that support comprehension and autonomy. Caregiver training, embedding health literacy into culturally competent education. Frailty-aware models, using literacy assessments to personalize care and reduce risk. Would you like to co-develop a framework that integrates these strategies into smart housing or adult daycare programs? It could be a powerful tool for advancing equality and independence in aging populations. Improving health literacy in older adults leads to a cascade of positive health outcomes, many of which are reflected in the rise of disability-free living between 2008 and 2017. Here's a breakdown of key benefits. Health outcomes of improved health literacy, reduced disability rates. Older adults with higher health literacy are more likely to avoid or delay disabilities related to memory problems, sensory impairments, limitations in daily activities, bathing, dressing, functional impairments, e.g., walking, climbing stairs, better chronic disease management, enhanced understanding of conditions like diabetes, hypertension, and arthritis, leads to fewer complications, lower hospitalization rates, improved medication adherence, increased preventative care use. Individuals are more likely to receive regular screenings. Get vaccinated, engage in early detection and intervention, improved mental health, reduced anxiety and confusion around health issues, greater confidence in managing one's health, enhances cognitive engagement through active learning, greater independence and aging in place, health literate older adults maintain autonomy longer, less resilience, reliance on long-term care facilities. Lower healthcare costs, fewer emergency visits and hospitalizations, more efficient use of healthcare resources, reduced burden on caregivers and systems, less physically demanding work, better access to healthcare services. Would you like to explore how these outcomes could be embedded into frailty aware care models or smart housing environments to support autonomy and resilience? It could be a compelling way to translate these findings into actionable design. Health literacy plays a pivotal role in shaping health discrepancies across different populations. And the study from Archives of Gerontology and Geriatrics Plus offers compelling insights into this dynamic. Here's a deeper look. Okay, folks. Give me 1 second, please. I'll finish this up for you. How health literacy impacts health discrepancies. Access to care. Individuals with lower health literacy often struggle to navigate complex healthcare systems. This leads to delayed diagnosis, underuse of preventative services, and poorer chronic disease management, especially in underserved communities. 2. Education as a proactive factor. The study shows that higher educational attainment is linked to lower rates of smoking and risky behaviors, less physically demanding jobs. Better access to healthcare and health literacy. These advantages disproportionately benefit populations with greater educational opportunities, widening the gap for others. Cultural and linguistically barriers. Health information that isn't culturally or language tailored can alienate non-native speakers or marginalized groups. This contributes to misunderstandings, mistrust, and reduced engagement with care. Gender discrepancies. Women saw a 26% increase in odds of being disability free compared to 18% for men. This may reflect differences in health seeking behaviors, caregiver roles, and access to education, factors influenced by health literacy, generalized differences. Baby boomers 65 to 74 showed less improvement in older cohorts, 75 plus, suggesting that disparities may persist or worsen in future decades without targeted interventions. Bridging the gap. To reduce discrepancies, health literacy strategies must be culturally responsive, reflecting diverse values and communication styles. Accessible, designed for varying literacy levels and cognitive capacities, community based, delivered through trusted local organizations, integrated, embedded in frailty aware care models and smart housing environments. Would you like to explore how these strategies could be applied to adult daycare programs or caregiver training frameworks? It could be a powerful way to advance equity and autonomy in aging populations. Okay, guys, so I'll be back on for B. So give me a few minutes, please. I'll be back on with B shortly. For now, Gator Wellness, take care, folks.